Hello and welcome to another session of Dr. Barbara Miller's NCLEX review. This session will focus on the postpartum phase. The fundus should be palpated in the middle of the abdomen. If the bladder is full, the fundus will deviate to the left or right. A boggy fundus signals uterine atony. What is uterine atony? It fails, the uterus fails to contract. So your intervention is to massage the fundus until it becomes firm and clots are expressed. You want to give oxytocin to promote contractions and reduce blood loss. On the day of delivery, the fundus should be at the level of the umbilicus and eventually falls below the umbilicus by 1 finger breadth per day. If it's above the umbilicus, you want to document as +1. If it's below the umbilicus, you want to document as -1. Voiding postpartum, you want to evaluate the ability to void, whether it's painful voiding due to edema in the first 24 to 48 hours, and you want to help void within 6 to 8 hours post-delivery. You want to consider a catheterization if needed. You want to monitor the output, the patterns, diuresis over 3,000 milliliter per day, normal in the first 2 to 3 days. You want to check for signs of bladder distension, the fundal height, displacement to the side, bulging, excessive lochia. You want to assess for tenderness in the bladder, frequent voiding, prompt patient to void if bladder displacement is suspected. You want to prevent atony. Maternal bradycardia common for the first 6 to 8 or 6 to 10 days postpartum. Elevation of temperature, normal, related to excretion and dehydration from the rigors of labor. Not a concern until it exceeds 100.4 degrees Fahrenheit for 2 days. Postpartum hemorrhage classified as a blood loss greater than 500 milliliters after vaginal delivery and 1,000 greater than 1,000 milliliters after cesarean birth. So what are some complications of postpartum hemorrhage? Hypovolemic shock and anemia. This can be caused by uterine atony. Remember, uterine atony is failure for the uterus to contract. Prolonged labor or oxytocin-induced labor or subinvolution of the uterus. What is subinvolution? The uterus fails to return to its pre-pregnancy state and condition. It could be a retained fragment of the placenta. It could be also a hematoma from the rigors of labor. You want to assess blood clots larger than a quarter or perineal pad saturation in 15 minutes or less, formation of hematomas, boggy uterine or uterus, also known as uterine atony, persistent lochia rubra beyond day 3, retained placental fragments, or change in the level of consciousness. Those are symptoms of shock. Subinvolution, know that subinvolution is failure of the uterus to revert to its pre-pregnancy state through gradual reduction in size and placement. So you want to massage, void frequently, and administer oxytocin. So you're going to encourage the patient to void frequently. Naloxone give to counteract respiratory depression in the newborn. Prolactin stimulate the secretion of milk from the mammary gland. The umbilical cord contains 2 arteries and 1 vein. Lochia, you got to know your lochias. I believe I had mentioned them, but I'm going to say it again in previous video. Lochia rubra, that's the first bleed. It lasts 1 to 3 days. It's bright red, may contain clots. Transient flow increases during breastfeeding and upon arising. Then you have lochia serosa. It lasts from 4 to 10 days. It's brownish red or pink in color. And you have lochia alba that lasts from day 11 up and beyond 5 weeks postpartum. That is yellowish or white creamy. If it continues above 5 weeks of postpartum period, then it could be some complication like a retained placenta or a hematoma. Know that ROGAM is given for unsensitized Rh negative mother after delivery of a Rh positive infant to prevent the development of sensitization or antibodies. It also recommended at 26 to 28 weeks of gestation. It's given to suppress the mother's antibody formation. It is ineffective against Rh positive antibodies that are already in maternal circulation. Rh negative client with Rh positive newborn requires Rh immune globulin IM within 72 hours after delivery. Direct Coombs versus indirect Coombs. Direct Coombs demonstrates if the patient's red blood cells have been attacked by antibodies against them, and usually seen with Rh negative mothers. This is done on the umbilical cord to indicate RH incompatibility. Indirect Coombs detect circulatory antibodies against the red blood cells during the prenatal period to show previous exposure to RH positive antigens. Indirect Coombs test identifies client synthesized to RH positive blood for clients who are RH negative and not synthesized. The indirect Coombs test is replaced between 24 and 28 weeks of gestation. Rubella, the fetus of a pregnant woman that requires rubella may develop congenital rubella syndrome that includes blindness, deafness, heart defects, mental retardation, cleft lip, and palate. Vitamin K increases prothrombin time in the newborn. So that's one of the medications given to the newborn, vitamin K. HIV and AIDS, there's a risk of sending or contracting or giving HIV to the newborn, even with aggressive treatments to the mom. Patient discharge. Prior to discharge, the nurse should include infant cord and male circumcision to the mother and family. So what's a circumcision? You want to apply petroleum jelly with diaper changes. You want to assess for urinary retention. You want to prevent cord infection by keeping the dry and diaper folded underneath. Cord infection, what are the complications? Inadequate cord care, and that can result in cord is not kept dry and clean. You want to watch for moist, red, foul smelling or draining from the cord. The boards will ask you, the cord falls off around 10 to 14 days. You want to bathe and submerge the baby after the cord falls off. And the circumcision, you want to observe for bleeding and then voiding. Postpartum urination, frequent voiding, less than 150 milliliters of urine is a sign of urinary retention. Hand hygiene is paramount between and after voiding. You want to cleanse the perineal area with warm water or antiseptic after voiding with hand squeeze bottle provided by the hospital that replace perineal pad by removing the front part first, peeling it towards the back. Always remove clean to dirty. Thank you for watching. Hope this short video on postpartum care beneficial to your preparation for the NCLEX. Please like, share, subscribe to the channel to help the channel grow. Thank you so much.